It is a Medicare Monday on a Medical Monday with John Dunn from Health Team Advantage. You've got your healthcare concierge, whomever it might be, or if you want to connect with one and create that relationship, the number to call 336-920-3648 and the website to visit htanc.com. John, ain't nothing scary when it comes to getting your Medicare Advantage plan in place, is it?
That's right, Jeffrey. This is the scary time of the year because of all the unknowns with Medicare.
Sure. And some folks go, well, I've heard this. I was thinking that. My neighbor told me this. You got to sit down and have that conversation. Find out for yourself.
That's right. It's an individual thing. What works for your neighbor or a friend may not work for you. Mm-hmm. And it may be different from one year to the next.
Yeah, and there are unique circumstances, and that's why it's so important that you have this conversation. And you can ask the questions. You can ask them once, 5, 25 times. It's fine with us.
That's right. Doesn't matter how many times you need to ask a question. The important thing is you get the answer.
So often we hear about it, I heard. And that's not unique to seniors that are getting ready to dip into the Medicare bins. Every circumstance is unique, and that's why this plan is so important. You got to find out what's going to put you in the best place.
Right, and this year is more unique than usual. More changes this year, especially with Part D drugs than I can remember in any past year. So more important than ever to ask those questions. Don't go on the I heard or your expert neighbor who thinks they're an expert in Medicare.
And they're well-intentioned.
And whatever they're on works for them. But like I said, it's an individual basis. So let's look at you as a person and decide which is going to work best for you.
So what are some of these big differences that you really got to look at when it comes specifically to Part D?
That's right. So everybody who knows anything about Medicare has heard of the dreaded donut hole or the coverage gap with drugs.
Okay.
Meaning that once you hit a certain dollar amount, then you go into this black hole. And I'm not sure what my drugs are going to cost when I'm in this black hole or donut hole. Well, that goes away for 2025, which is a great thing. Once you have reached your out-of-pocket cost of $2,000, your cost of drugs for the rest of the year go to zero.
So the way it was, you could get to September and go merrily on down about your way to pick up your prescription. But this time you go in, Medicare's paid all it's going to pay. So now that full bill is due out of your pocket to get your prescription.
But what it was during the donut hole for 2024, you were responsible for 25% of the cost of that drug. Now, we all know cost of drugs has skyrocketed.
Sure.
So you're talking maybe 25% of a $1,000 drug.
Right.
$250.
$250.
Or a $1,500 drug.
Mm-hmm.
And you don't know the exact price of that until you are there at the counter.
Now you come in September, October, and November, you're still getting your medicine, and you know what you're looking at out of pocket from January to December.
That's exactly right. And the only surprise you will get is when you go to the pharmacy and find out, hey, I've hit my $2,000 max, and now my cost is zero.
Right.
Great surprise.
Yeah, and that's one that you want to know. And so, folks, if you're unsure, maybe you're not even sure what you're paying monthly for certain medications, that's when it comes in that you have your healthcare concierge, you have this relationship, you can call. If you can't say the name of the medicine, you are not alone.
No, you're not alone.
Words. You can spell it. We can take a picture of it. You can come see us.
That's
the
exactly
Benefit
right.
Center on Summit Drive in High Point, or give us a call. The healthcare concierge can look up all this and give you a specific monthly number. So as you budget, I'm looking at $20 a month. I'm looking at $100 a month, but then you can be prepared for that. No,
that's exactly right. Yes. I'd say when you're ready to have that conversation, have the spelling of those drugs with you. It is so important we get it right on our end.
You don't have to say it. If you can spell it,
perfect.
If you bring it
even
to our Benefit Center in High Point.
The unknown is the worst, Jeff.
Right. Well, what is this going to cost?
Right.
And that's not good for your mental well-being. That can impact you. It's another worry. And so particularly if this is a chronic situation, it's ongoing, you're going to be on this prescription for the foreseeable future.
Right.
So, all right, that's Part D. And that Part C is the fun stuff.
It is. That's the Medicare Advantage plans. Those are the plans that they have to cover what's in Part A and Part B. They will add in your Part D drug coverage, And then they'll throw in a lot of additional benefits called supplemental benefits, such as dental, because believe it or not, Medicare doesn't cover dental. It's amazing that we're 2024, almost 2025, and Medicare doesn't cover dental. So these Part C plans will throw in benefits for dental, vision, your routine vision, hearing benefits, gym memberships.
That's not just the physical part.
Oh, no.
That's the emotional connection that you are not on this journey by yourself.
That's right. That social aspect is so important.
Absolutely. So, yeah, that the wellness programs, we talked about silver sneakers as well.
Right.
And then if you want somebody to just come hang out, visit, maybe doing a little bit of just let's connect at the old home place, right?
That's exactly right. These Part C plans continue to get better and better. That companionship benefit is a new one. But it's great. We call ours Papa Pals at Health Team Advantage. And you give a call, schedule someone to come out. They'll sit with you. They'll do light things around the house. They'll even take you to a doctor's appointment or the grocery store. It's a great benefit. It's there to alleviate some of the pressure from family members.
Right.
Doing some of those duties. Yeah. So
and John, then there's also that so many of us find ourselves in that place yet. Maybe we fail. So, and you're recuperating, and the hospital says you got to go. And so you're not ready to go home yet. So you go to a skilled nursing facility. You got to do a little bit of rehab. Maybe they're 2 weeks, maybe 10 days, maybe it's a month. Right. And then we're going to segue home, which is always the point, to get you back in your home
And it's
place.
the scary point. They know now in 2 days I've got to go home, and they're thinking, there's no way.
Right.
I'm ready to go home.
And so there is help available.
Absolutely.
So Part C is the fun stuff, and then Part D is the drugs.
That's right.
Part A and B, original Medicare, John.
Part A and B, original Medicare. Part A, most people have no cost for it at all. It is paid for out of that Medicare deduction you've seen out of your paycheck for years and years and years, and you automatically qualify for Part A, which covers hospital expenses, and hospital expenses pretty much only.
So if I got to go to the doctor, get an x-ray, I want to go get my flu shot. That comes out of?
That will be Part B.
All right.
Part B is the part that we do have to pay for.
Okay.
Once we're retired and on Medicare, it comes with a premium. Changes from year to year. This year for 2024, it is $174.90. We don't know yet what it will be for 2025. Waiting to see. Usually in December it gets announced. But that goes to cover your doctor's visits, those outpatient procedures, those labs that are done outpatient.
So that's Part A, B, C, and D.
That's
kind
right.
of gets everybody clear. And then some conversations that we need to have, John, about prescription drug prices, because people want to know, what am I looking at month in, month out? But then the other big question is, my doctor,
huge question.
Or is she covered by Health Team Advantage? So how do we find that out?
Well, if you're one of those that want to venture out on your own and look, you go to htanc.com.
Okay.
In the top toolbar, there's a little button that says Find a Provider.
Okay.
Click on that. It takes you right to the tool where you can key in your doctor's name, zip code he practices in, hit search, and then it will start populating that list for you. Or just give us a call and we'll do that legwork for you.
So you can just find out. Maybe there's a new doctor. Maybe your doctor retired.
That's
moved out of town. Maybe you are new to the area. And of course, a couple of years ago, John, we were looking at 12 counties for Health Team Advantage. And my, how times grow when what you're doing works.
We're moving up from 12 counties to 33 counties. That service area has grown tremendously. Pretty much what you can do is look at I-77 and go east. We got a couple counties on the western side of 77, but most or to the east.
Yeah, then we're talking about HMO versus PPO. Can you guide us through this?
The difference is with an HMO, your care is specific to the doctors and hospitals that are in that insurance company's network. If you go outside of that network, you're going to be paying all of the cost yourself.
Okay.
Whereas with a PPO plan, you have out-of-network benefits. You may have a slightly higher copay for going to a doctor out of network, but it's still covered. So a huge difference between those two.
So with a PPO, I would have my provider that I would choose.
That's right. You would still have your provider that you go to for your routine things. But something major comes up, and you want to go to John Hopkins or MD Anderson,
All right.
which is out of network, but with a PPO, you still have out of network benefits.
Sure.
Meaning you won't be responsible for that full cost.
And with an HMO,
you're kind of locked in.
This is my home area. I'm not going to stray.
Right.
I get everything that I anticipate needing, and for the next calendar year, I'm going to get it in this network.
That's right.
So, and that makes a difference in what kind of plan you choose. And that's one of the reasons that you need to sit down and have this conversation with your healthcare concierge.
We just happen to be very fortunate here in North Carolina where we've got so many great doctors that cover the full spectrum of care that you need. And very seldom does anyone ever need to really go outside of that.
This is a local company.
They
get it. They know where you are and what you're doing and what you need, right?
That's right. We are owned by two of the larger hospital systems in the state. We're owned by Cone Health and Novant Health. Mm-hmm. But that doesn't mean they're the only providers in our network. We've branched out much further than that with Atrium, Wake Forest Baptist, UNC Health. There are so many others that are in our network other than the two health companies that own us.
Sure. And then also, just to put your mind at ease, if it's an emergency situation.
Emergencies are always treated as in-network.
All right.
We want you to get that care. That is so important to be able to have access to emergency care when and where you need it. So that's all treated as in-network.
Yeah, so don't worry about that. If you got family in Texas and you're down there visiting with the grandbabies, you're going off for the holiday season, you're still under the umbrella. Well, let's talk about the deadlines.
So we're in the middle of this deadline right now. This is called Annual Enrollment Period, or AEP, and it goes from October the 15th to a deadline of December the 7th.
Well, you know what? I made a decision last week. Then my son came home. We talked about everything, and I think I want to change my mind. Can I?
Absolutely. You have until midnight, December the 7th, to change your mind. Your last application in as of midnight, December the 7th, that's the one that counts.
But I promised an update on the website. Bigger, better, bolder, packed with great information. What's available on the HTANC website?
Well, for those who are comfortable surfing, we have tried to make everything available that we look at ourselves to be able to make an informed decision. But it's great information there. If someone calls in and says, how do you pay this benefit? Those are there. Summary of benefits, looking up your doctor, looking up your medication, all there at your fingertips on the website.
So annual enrollment period, make your choice. One of the things I posed this query, folks coming up, maybe they're well past 65, but they've been happily at work.
Yes.
And that happens. That's not an uncommon circumstance.
More and more.
But now they go, you know what? I think I'm about done.
Right.
Or perhaps you're turning 65.
Works the same for both.
So what's the first step and how do we proceed? And what's the timeline, if you can talk us through it?
So for those, whether you're turning 65 or you have worked past 65 and have had that group insurance in place and haven't needed Medicare, 3 months before that date, contact Social Security, because you have to get Part B going yourself. That will not happen automatically.
Mm-hmm.
So call Social Security. You can do it over the phone. You can set up an account with Social Security and do it online.
All right.
Or you can go in person. Either of those three ways work, but you have to get that Part B effective date set for the month that you're going to retire.
Okay.
Or the month you're going to turn 65 and want to go on Medicare.
All right.
But the key is do it 3 months ahead of time.
And there is a consequence if you put it off.
There is. So you will start accumulating a penalty, and that penalty will stick with you the rest of your life.
So you don't get to do away with it. It's not, it's with you. If you miss the
grace
deadline,
period.
You got to. So you really need to take care of that. So now, if folks hear this and we talk about December 7th as the deadline, 11:59, and they go, "Oh my gracious," don't panic. Even if it's now, go ahead and call today and start the process.
That's right. Yeah, it's not too early now. Let's go ahead and get it done.
If you've not done anything yet, go ahead and start that process today. Now, I've got the Health Team Advantage website pulled up, htanc.com. It's in big font.
Has to be.
And this is in a font that I can read.
Exactly right. with a bigger font. Of course, you might have to scroll a little bit.
That's fine.
But that's okay. I can read what's there.
And right there on the main page, htanc.com or healthteamadvantage.com, whichever you want to type in.
Either way.
You can go there. Choose your county to view plan options. And right here, all the counties listed in alphabetical order. It doesn't get any easier. Again, and it's not just big, it's big and bold.
Can't miss it.
The phone numbers listed here. You've also got shop plans. This is a drop-down menu. There are PPOs, there are HMOs, eligibility requirements. You can schedule an appointment.
Yes.
And then plan resources. Find a provider. Now, there's also another link to this. We just talked about this.
Mm-hmm.
You click on it. Right here it is. Find a provider for 2024.
Make it
find
easy,
a provider
Jeff.
for 2025.
That's right, because we still have people aging into Medicare for 2024, even though most of the concentration right now in AEP is for January 1st, 2025. We can't forget those who are still eligible in 24.
That's right, because we've got a couple months here still to go.
That's right.
And if you need to check on a doctor, then you've got prescriptions.
Yep.
This is a drop-down menu, pharmacy information, what the formulary. That's what you cover and how you cover it.
That's right. So that drug, what tier does it fall in? Because depending on the tier will determine what your cost is at the pharmacy. We don't want any surprises.
No. We want you to be an informed, make knowledgeable decisions.
Absolutely.
And reduce the surprise effect.
Yes.
When it comes to your health care. There's Medicare basics here, understanding Medicare, your eligibility. And John, it's easy because we talk about it every month.
Right.
How to have that 40 quarters, right?
Yes, to get that Part A fully paid for, you have to have worked 40 quarters, meaning they had that Medicare deduction for 40 quarters throughout your lifetime. Now, those who may have been stay-at-home parents or didn't work, you qualify for that under your spouse's time worked as well. So you may be one of those, hey, I stayed at home and took care of the kids my whole life and I didn't work. Well, you still qualify under your spouse's time work.
And you did work. You worked harder than everybody else.
You worked.
You did. You put in 10 times the effort the rest of us did.
Yes.
And then also, Health Team Advantage understands it's not just you.
Right.
It really is the entire village. And so there's information on the website under information for caregivers.
Absolutely.
As well.
Key aspect as we, get into retirement years and looking for health care, those caregivers are big proponents for individuals in Medicare.
Yeah, and sometimes
they
that
usually
is a
see
burden.
firsthand before anybody else does.
Sure. And we know it. And, they've got their own responsibilities, their own families, and they love you. But sometimes we run ragged. And that's why calling a healthcare concierge at Health Team Advantage can be so beneficial. If there's an issue with a claim or a billing, which happens.
It does. Typo, wrong code got filed. It can be any number of things. And that's why I tell people, if something doesn't look right on your bill, immediately reach out to your concierge.
Yeah, and it's not about people being mean.
It's just a human mistake sometimes.
So those are things that we can be corrected.
Right.
We can take care of that. One little phone call.
Absolutely.
If you're going to find a doctor, the word you got at the doctor's office was you need to see a specialist. And so you call your healthcare concierge at Health Team Advantage. You have those listings available, and then they can help make that appointment also. Your healthcare concierge can work with you to schedule your doctor visits. And then again, look up medications. You talked about, you just had a new one this week.
Yes. Never heard of it before.
And sometimes for those of us in that sandwich place, we've got our own kids and we've got parents.
Yes.
So you're responsible on both sides of that cookie. And there are times, this happened in my own experience, John. I would walk in and want to go through my mother's medicine, and there would be a medicine I had never heard of. She had not mentioned to me.
Right.
And you go, hey, Mom.
What's this for?
What is this? I don't know. The doctor gave it to me. Okay. Well, certainly you can call the pharmacist. You can call the doctor's office. But you can also call your healthcare concierge.
That's exactly right. And we have a whole group that does nothing but deal with prescription drugs.
So, the number to call, 336-920-3648. And there's the website. There's just a ton of information. We've barely dipped in and shared 1% of what's available on the page. One of my favorite, you get to know a little bit about your healthcare concierge.
You get a magnetic business card with your healthcare concierge picture on it, phone number to contact them, stick it right there on your refrigerator, make it easy to find, because they're going to be your biggest asset and your biggest advocate.
Sure. And we all need a cheerleader on our side.
These people are amazing. I call them the backbone of Health Team Advantage. They're on the phone all day, every day, 7 days a week right now, 8 a.m. to 8 p.m. And honestly, every one of them that I meet and talk to, they really care about people. Because you couldn't do that job and not care about people.
That's right. And so you are not alone, and you're not talking with just some random customer service rep in another state that has no idea and they're punching the clock.
Punching the clock, looking to get you off the phone call as quickly as they can.
You can speak with your person. You're not starting over.
That's
the conversation continues. It doesn't restart.
They keep great notes in the system of, this is what I talked to this member about last. Because if your concierge is busy with another one of their members, you can leave a message for them, or you may choose to talk to the one that is going to be available the soonest for you. Well, they will still have all of your information right there in front of them.
So if there's a sense of urgency, somebody is always available. John, one of these things that we should not pass over, because for so many folks, it is directly applicable, the chronic special needs plan with Health Team Advantage.
Absolutely. So 5 years ago, we're looking at the population here in the Triad, and we have so many diabetics, and it's like, what can we do to make their quality of life better? So we designed a brand new plan. It's called a chronic and special needs plan, and it's specifically for people who have diabetes or congestive heart failure.
All right.
And we go above and beyond what we do with our normal plans with extra care management, going the extra mile to make sure those diabetics are taking their insulins like they need. And we made the price of insulin on our diabetes plan zero 5 years ago before the government ever stepped in and started regulating insulin prices. Those drugs, they're in the class of GLP-1 drugs, but they are the Ozempics, the Trulicities, all of those that are not insulins, but they go a long way in helping how insulin is regulated in our body. And those drugs have done a lot for diabetics. Those are zero cost share on our plan. And we've had a lot of great success. So if you are on Medicare and have one of those conditions, Health Team Advantage is a great place to start.
But you've also got your syringes, you got the alcohol wipes, you got the glucometer and the testing strips. This is all part of managing this chronic health condition. And it does not have to be an end of life kind of situation.
No.
We want you to get out and go and enjoy.
And not just survive, but enjoy and thrive.
Be vibrant. And we want to love on you as long as we can. John, is it automatic?
It is not automatic.
Okay.
What is automatic is if you're on a plan currently and you do nothing, you will stay on that plan for next year. May not be the best plan for you.
Because health situations are in flux. So what worked for you in 2024 may not be the best plan for you in 2025. And then, is it too expensive for me? Is this just something for a select few, or can everybody participate?
Everybody can participate. Our plans are zero premium.
Okay.
So you still continue to pay your Part B premium to Medicare, but you pay nothing to us for a monthly premium.
I've heard that some people younger than 65 can qualify for Medicare.
Those who have been on disability through Social Security for 2 years, 24 months, are eligible for Medicare.
All right.
A lot of them do not know that. You may have gone the route of trying to get Social Security disability on your own, and then from there you do not know what your options are for health care. If you have Lou Gehrig's disease, ALS, you are eligible for Medicare.
All right.
If you have end-stage renal disease, meaning I'm on dialysis, you are eligible for Medicare.
And that's an immediate.
If
you have
both of those diagnoses are immediate.
Chronic renal or end-stage renal. Some people go, I don't think I can get Medicare, which is typically age-based, and that is a national program. If I have Medicaid, which is a financial situation, and that is state by state. So how do those two connect?
Yes. So Medicaid, like you said, it's income-based. And you can have both Medicaid and Medicare.
All right.
And they work great together if you do have both. because usually you'll have a zero cost share for everything from a hospital stay to a doctor's visits and prescription drugs.
So having Medicaid does not disqualify you from participating in the Medicare Health Team Advantage plan.
Does not. They can work great together.
All right, my friends, the number 336-920-3648. John, it's the best time of the year. We'll talk again
That's right,
soon.
Jeffrey. Enjoyed it.
All right, it is Medicare Monday on a Medical Monday with John Dunn from Health Team Advantage.